All right, so today we're going to be exploring something pretty interesting.
Yeah.
It's where the worlds of nursing and yoga kind of collide.
Yeah.
We're doing a deep dive into yoga nursing.
It's kind of a fascinating concept.
Yeah,
It's not just nurses doing yoga,
right.
on their break.
Great.
It's a whole system designed to kind of tackle the stresses of the profession.
Yeah. Our source material today is the Yoga Nursing Essentials website.
Oh, cool.
And this is like getting a backstage pass into this whole world.
Interesting.
They even have an e-course.
Wow.
But we're going to be focusing on the website for this deep dive.
Gotcha.
And it's really exciting to see how they're using this approach to potentially improve patient care.
And what's interesting is that it's not about replacing, traditional medical knowledge.
Right.
It's working alongside it
Yeah.
as a complementary therapy.
That makes a lot of sense, especially when you consider how demanding nursing is.
Right.
I mean, long shifts, emotionally charged situations. It's no wonder that that stress levels are so high.
Yeah, the course actually cites stress as the #1 preventable cause of disease and burnout,
Wow.
which is especially relevant for nurses.
Absolutely. So how does this yoga nursing actually work?
Well,
Is it just teaching nurses, how to do yoga poses?
it emphasizes gentle therapeutic yoga,
Okay.
you know, f- safety injury prevention,
Yeah.
but it goes beyond that.
Okay.
They have something called the 3-part Sacred Remedy RX,
Interesting.
which they claim is a simple but powerful way to deal with stress, anxiety, even pain.
That sounds promising. The website kind of keeps the content of this remedy under wraps,
Right.
but it implies that it's kind of the heart of the yoga nursing approach.
Yeah.
Do they back up these claims with any concrete benefits?
They list a range of potential benefits for both nurses and patients,
Okay.
and some of them are quite surprising.
Like what?
Improved sleep, lower blood pressure, a stronger immune system, even better concentration.
It's interesting to think about how these benefits could translate into real-world scenarios
Absolutely.
for nurses.
Yeah.
Like imagine feeling less drained during a 12-hour shift
Uh-huh.
or having more emotional resilience when you're dealing with difficult patients.
Exactly. It could potentially be a game changer for those struggling with burnout.
For compassion fatigue.
Yes, speaking of potential benefits, the financial aspect of this is kind of intriguing.
It is.
The website actually positions yoga nursing as a possible career path.
Yes. And they connect it to the booming corporate wellness industry.
Interesting.
They cite that spending in this area has tripled recently,
Wow.
making it a $1 trillion market.
So businesses are investing heavily in employee wellness.
Right.
But how does that translate into opportunities for nurses specifically?
That's where the yoga nurse comes in.
Okay.
They envision nurses using their skills to become RN wellness coaches, stress reduction experts,
Interesting.
working with both hospitals and businesses.
Wow.
They even suggest earning potential ranging from $75 to $150 an hour,
Really?
or over $1,500 a day.
That's pretty significant earning potential.
It is.
Does the course address the practical steps of building this kind of career? Like how do nurses market these specialized services or
Yeah.
handle potential licensing issues?
You raise some important points.
While they paint this picture of financial empowerment,
Right.
they don't really get into the nitty-gritty of setting up a practice or navigating the legal landscape.
Right.
That would definitely be crucial information for anyone seriously considering this.
Yeah, to clarify, can any nurse just hang up a yoga nurse shingle and start charging those rates?
That's where things get a little nuanced.
Okay.
The course makes a distinction between teaching yoga nursing essentials
Okay.
and actually calling yourself a yoga nurse.
Okay.
Full certification is required for the latter.
So there's more formal pathway involved?
Exactly.
Okay.
While this website doesn't provide the details about the certification process, it's clear that it exists.
Right.
Anyone truly interested in this career path would need to investigate further.
Okay, let's switch gears for a second and talk about the person behind all of this.
Okay.
Annette Tersigny.
Okay.
Her journey is pretty remarkable.
It is. You wouldn't necessarily expect the founder of yoga nursing to have a background in modeling.
Yeah, it's quite the unexpected trajectory. Yeah.
She transitioned from modeling to becoming a yoga instructor and eventually a nurse.
Wow.
It seems like all those experiences converged to create yoga nursing.
Absolutely. Her diverse training background, Kripalu yoga, integral yoga, even studies with Deepak Chopra.
Wow.
Suggests she's drawing from a wide range of influences.
That's an interesting point,
Right.
because it means she's not promoting just one specific style of yoga.
Right.
So it could make yoga nursing more adaptable to different individuals and needs.
Exactly.
But is her personal experience enough to lend credibility to this entire approach?
That's a fair question.
Yeah.
While her story is compelling, it's important to look beyond individual testimonials
Right.
and consider the broader evidence
Yeah.
and research behind yoga nursing.
Right. And the website does include quotes from other nurses who have experienced yoga nursing firsthand.
Oh, cool.
Let's hear what they have to say
All right.
about it.
Yeah. It seems that they're using it in a lot of different ways, from self-care to patient care and even career changes.
Yeah. It speaks to the versatility of the approach.
It's interesting to hear those different perspectives. It shows that yoga nursing isn't a one-size-fits-all solution.
Right.
It's more like a set of tools that can be adapted to different needs.
Exactly.
But if this is so beneficial, why isn't it more widespread?
That's a really good question.
Yeah.
Integrating anything new into healthcare can be challenging.
Yeah.
There can be resistance to change, skepticism about anything considered alternative,
Right.
and just a lack of awareness.
Yeah, the healthcare system isn't exactly known for being quick to adapt.
Right.
New research can take forever to be implemented into practice.
Exactly. But what's fascinating about yoga nursing is that it's not relying on some, complex new technology or procedure.
Yeah.
It draws upon ancient wisdom and practices, things that have been around for centuries.
So in a way, it's going back to the basics, but
Right.
with a modern twist.
Precisely. It's about rediscovering the power of the mind-body connection.
Yeah.
And recognizing that healing goes beyond just treating physical symptoms.
Yeah.
Perhaps this resonates with nurses because they're already so attuned to the human side of healthcare.
Yeah, they see firsthand the toll that stress takes on patients.
Right.
And maybe they're looking for ways to address that more holistically.
And let's be honest.
Yeah.
Nurses are under immense pressure themselves.
Oh, yeah.
They need effective ways to manage their own well-being, too. This is where the self-care aspect of yoga nursing really shines. It's about equipping nurses with tools to thrive in such a demanding profession.
It makes you think about the potential ripple effect.
Mm-hmm.
If nurses are calmer,
Yeah.
more centered, less stressed,
Right.
wouldn't that impact the care they provide?
Absolutely. It's about shifting the entire culture of healthcare, starting with those on the front lines.
So where does all of this leave us? What does it mean for nurses, for patients,
Right.
for the future of healthcare as a whole?
In my opinion, the key takeaway is that yoga nursing offers a potentially transformative approach. It's not a fad.
Yeah.
It's a movement led by passionate nurses who are advocating for a more holistic integration of these practices into mainstream healthcare.
And it seems to be gaining momentum
Yeah.
as more and more people seek out, mindfulness stress reduction techniques,
Right.
alternative therapies.
This could be a glimpse into the future of healthcare.
Mm-hmm.
Imagine a system where nurses are empowered to incorporate these techniques into their daily routine,
Yeah.
where patients are seen as whole beings, and where self-care is considered essential to providing high-quality care.
Yeah.
It's an inspiring vision.
It really challenges the status quo
It does.
and asks, what if there's a better way?
Exactly. And that's what Annette Tersigni and the yoga nursing movement are doing.
Right.
They're pushing boundaries, redefining what it means to be a nurse, and offering a glimpse into a future where healthcare is more holistic, compassionate, and effective.
Yeah.
This definitely gives us all something to think about.
For those who want to explore further, you can find a link to the yoga nursing website in the show notes.
It's a great resource packed with information about the program, the philosophy, and the remarkable woman behind it all.
But before we wrap up, I want to leave you with one final thought-provoking question.
Nope.
We've talked about stress as a major problem in healthcare for both providers and patients.
Yeah.
It contributes to burnout, illness, even medical errors.
It does.
So what if integrating simple mindful practices could truly shift things for the better?
What if instead of simply reacting to illness, we could proactively address stress and promote well-being from the ground up?
What if yoga nursing or something similar could hold the key to creating a healthier, more resilient healthcare system for everyone involved?
That's a powerful question to ponder.
Yeah.
And perhaps it's not as far-fetched as it might seem.
It's amazing to think that something as old as yoga, could be the key to changing healthcare.
It really is. It speaks to how powerful these practices are and how relevant they are.
Yeah.
Even in today's world, we're so focused on all this new technology, but sometimes the simplest solutions are the best.
Yeah, the course creators seem to be really tapping into that wisdom. and adapting it for the challenges that nurses face.
Yeah.
But could this be something that's integrated into, like, nursing education as a whole?
Oh, that's interesting.
Could it be a standard part of the curriculum?
That's a really intriguing idea.
Hmm.
Imagine if every nursing student graduated with
Right.
not just clinical skills, but tools for managing stress,
Yeah.
cultivating mindfulness,
Yeah.
fostering their own well-being. It could totally revolutionize the profession.
It would be a big change in how we think about nursing education and the skills that nurses really need.
Right.
But given how much stress and burnout there is,
Absolutely.
it might be a change worth exploring.
It really raises the question of if we are even preparing nurses for the mental and emotional demands
Right.
of their work.
Right.
Equipping them with these practices from the start
Yeah.
could have a huge impact on their careers and their lives.
And on the patients they care for.
Exactly. Imagine a healthcare system
Yeah.
where nurses aren't just clinicians.
Right.
They're like compassionate guides,
Yeah.
helping patients, not just with their physical problems, but also with the emotional and mental parts of healing.
That's a great point. It's a vision worth striving for.
Yeah.
A healthcare system that truly values the well-being
Yeah.
of both patients and providers.
So we've covered a lot in this deep dive.
We have.
From the techniques of yoga nursing
Right.
to the benefits, career opportunities,
Yeah.
even how it could change healthcare.
It's been a really interesting conversation.
We've looked at the philosophy, the practicality, the vision.
Absolutely. And it's given us a lot to think about.
If any of our listeners are interested in learning more,
Yeah.
there's a link to a yoga nursing website in the show notes.
It's a fantastic resource
Yeah.
for anyone who wants to explore more.
Whether you're a nurse, a healthcare professional, or just someone who's interested in wellness, I encourage you to check it out.
You might be surprised by what you find. That's it for our deep dive into yoga nursing.
Yeah.
Until next time, keep exploring, keep questioning, keep seeking those connections that help us understand the world around us.
And as always, take care of yourselves.